Mr. Beach, my last question, I think what I just heard you say is basically we could invest $1 and get $9 back. Did I hear that correctly?
That's correct. And that $1 will also be covered. When you think about how money, we just heard another layout where it was like, well, this money comes from here, but it gets covered in the supplemental. Well, we are going to lower costs across our budgetary needs at the local level and at the state level by having more people with insurance. So it is $1 up front to get $9 back, but it is a net savings across the board.
Absolutely. So my real last question. So I do hear this argument a lot about Medicaid expansion, and I'm sure we'll hear it this evening, that just because someone has health care coverage, just because someone has insurance, that doesn't mean that they'll get health care. Can you respond to that argument?
Absolutely. When Texas kids have health coverage, 85% of them receive their annual well visit. When Texas kids do not have health coverage, 56%. That's a difference of nearly 151%. When it comes to uninsured adults in Texas, only 34% reported having a primary care doctor to see when they were sick, compared to 79% of adults with health insurance, a jump from 34 to 79. So I agree. Insurance doesn't equal coverage. It doesn't equal wellness checks. Insurance enables wellness checks. And if we can get more, then we would be doing something tonight by passing a truly pro-life amendment right here, a pro-jobs amendment, and a pro-Texas amendment.
Thank you, Mr. Beasley.
Thank you, Mr. Chairman.
Mr. Schatzline, for what purpose? Ms. Rose, for what purpose?
Thank you, Mr. Speaker. Will the gentleman yield?
Does the gentleman yield for questions?
Yes, ma'am.
The gentleman yields.
Okay, thank you. Representative Busey, you made some great arguments, or points, I should say, regarding this issue. So could you tell me how many states, a lot of states have expanded Medicare. How many states have not expanded Medicaid, I'm sorry.
I believe roughly 41 states have expanded Medicaid. We're just leaving about 10 left. When you think about who's done it, it's not just blue states at that number. We've seen lots of states, red states, blue states, and they've done it because, and I think this is key to the conversation, members, that we maybe forget about here. And I want to say this to those that are in line, and I love to have this conversation now and in the future with y'all. This is not our fight to decide if you agreed with the Affordable Care Act. This is not our fight to decide if you agreed with Medicaid expansion. That is Congress's fight. Many of you are probably going to run for Congress one day, and when you're up there, you call your member of Congress, have that conversation. Talk to them about how to make that bill better. Talk to them about how to change that bill. What we determine here at the state level is because Congress is taxing you, they're taxing me, they're taxing Texans to support Medicaid expansion right now. Do you want to bring those tax dollars home from the federal government to help Texans, or do you want to keep sending them to California? Because when we refuse to expand Medicaid, we send Texas tax dollars that are paying for Texas Medicaid expansion, because we're not out of paying the tax. We send it to California and New York and other states that have done it. So our choice isn't, do we like the Affordable Care Act? Do we like the president that did it? That debate is fair to be had, but that's not our debate. Our debate is, do we want Texas tax dollars coming here or going to another state?
You also talked about rural hospitals and when they're closing. Could you talk about the impact that it has on a community when a rural hospital closes?
Rural hospitals are living on the edge already. We've talked about this in Public Health Committee many times already this session. We've had more rural hospitals close in Texas than anywhere else. It's 26 hospitals that have closed in Texas. There's another 75 living on life support right now. And a big part of that, as we've heard from the agencies, is uncompensated care, is not getting it done. We have so many people, because of not expanding Medicaid, the highest rate in the nation, that do not have health insurance. So when you go to the hospital, you have to get emergency room coverage at the highest cost possible to take care of your problem. When more people, as we've already shared the stats, have insurance, then they get their preventative health care and they get those wellness checks, and we avoid the highly cost things down the road. And also, when it's your first time to deal with the problem at the emergency room, it couldn't cost more, and it is bankrupting rural hospitals. This would have an impact, as we said, on all Texans, urban, suburban, and rural alike, but it would impact rural Texas more than anywhere else.
Representative Busey, wouldn't you agree that people who are eligible for Medicaid are our seniors, they're the disabled and their children, right? They're not just healthy.
So,
go ahead.
absolutely, and we talked about that, and that's who's getting this coverage. What we want to talk about with the Medicaid expansion gap, and I think it's important too, because we hear the pushback sometimes. These are working Texans. They're working Texans. These are people that have a job. They're out there getting it done, but they are not making enough. For whatever reason, they have a job that our society is not paying them a true living wage to live in our communities, and so they can't afford it. So we're trying to go from the 100% of the poverty level to the 138% of poverty level. I want y'all to know what that means. We all talk about how we don't really make money as state reps. We make pretty close to that level with our $7,000, and then you add your per diem in, because it's $21,000. If you live alone and you're making less than $21,000, we're trying to help those working Texans. A year.
Thank you, Representative Busey.
Thank you, Representative.
Mr. Kane, for what purpose?
Gentleman yield.